You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. According to my first guest, he says that for some people, especially those that don't like their smile, that an improved smile can absolutely change your life, especially if you don't like your smile. And so we've invited New Jersey's go-to cosmetic dentist on the program today, Dr. Konstantine Trichas. Dr. Trichas, welcome to the program.
Thank you, Randy. Pleasure to be here.
Now, you've developed, I guess, quite a reputation in Jersey. This is like the go-to guy for cosmetic dentistry.
Well, we've worked hard at developing that title, and it's something we enjoy doing.
So who's the typical cosmetic dentistry patient these days?
You know, Randy, we don't have a typical patient. So a typical patient could be anybody who wants a beautiful smile. It could be the 30-year-old who's getting married. It could be the 20-year-old who's graduating from college. It could be the 70-year-old who's widowed.
70-year-olds are doing it?
70-year-old
like veneers?
70-year-old who's widowed and wants a new start in life. It can be anybody who wants a beautiful smile. Why not?
Now, you're Setter, and we're talking about cosmetic dentistry and veneers today, but I guess you have this concept of you pretty much do everything under one roof. Elaborate.
Absolutely, Randy. In our office, we perform all the most procedures. We perform root canals, Invisalign, makeovers, implants. So everything's done in one house, essentially, and patients love that fact that they can come to one location and not be essentially sent all over town to get their work done.
So is cosmetic dentistry more art or more science? Or a combination of both, I guess?
Randy, cosmetic dentistry is definitely a combination of both. Of course it's art. It's you either have it or you don't. It's very much an artistic discipline, and I've gone all over the country to learn from some of the, I've had mentors, I've studied countless hours to be able to provide this type of service to my patients.
Because it's not a recognized specialty like a cosmetic dentist, but I guess probably even 10% of dentists or less than that, or even guys that have committed to, because this is your focus, right?
Cosmetic smile design is what I focus in on, and that is the blueprint that we as cosmetic dentists use to provide beautiful, natural smiles.
And I wanted to ask you this because knowing you're coming here, that I feel like I could spot big giant veneers walking down the street from 20 yards. Is it the patients want this big teeth look, or is it the doctor maybe that didn't do it right? I mean, you tell me, because I know you want to be positive about other dentists.
Yeah, I mean, the reality is the patient does not want that, and that what a patient wants is a natural smile, and unfortunately, a doctor has to start somewhere. So maybe during they're starting their cosmetic career, they have to build years and years of clinical skills and creating a process that allows for the transformation to be natural.
Now you say it's like for some people it's life-changing.
Yeah.
Is that an overstatement?
Oh no, absolutely not. It's transformational, Randy. It's been holding them back for 20 years, and now you're unleashing them, and for the first time they're able to learn how to smile, and they've been holding back so long that the ability to smile again takes some time, but they are transformed.
What do you mean it takes some time?
They've been hiding that smile, so there's stepping stones to learning how to smile naturally. They go from a forced smile to a guarded smile to like busting loose and letting their personality out. I mean, that takes time. You've been holding back for 20 years. Do you think you could just literally turn that loose in a matter of 2 hours? It takes time.
Are there that many people that don't like their smile?
Oh, absolutely.
Like, is it all over the place? I mean, you hear it all the time, I guess.
Anecdotal stories. I go get my cup of coffee in the morning. I go to Starbucks, barista. I crack a joke. I make her laugh. What does she do? She hides her smile with her hand. So by seeing that barista, Randy, I can change her life. I can make her smile again. I can make her, refrain from hiding her smile. So,
you don't give her a card, though.
I don't, but I'd love to. I'd love to be able to change, one smile at a time. I mean, that's my passion. So
you, as a dentist, you walk around, or you're in Jersey, and you could tell who's hiding their smile.
Oh, absolutely. I mean, I can tell within a millisecond what's going on. So it's a shame, but there are endless transformations that can take place.
Now we were in the green room. You showed me some of these photos, and these are somewhat dramatic. So what are we looking at over here? You brought some photos.
Oh yeah, I brought some photos. So what I have here are some transformations that I'd like to share with you. What we have here is Anthony. He has a super dynamic guy, but he has a problem. He has worn teeth. They're flat. They age him prematurely. He's got black holes near the corner of his mouth.
All right.
And essentially, what does he want? He told me he wants John Travolta back. What does that mean? He wants a youthful smile. He was a handsome guy. He showed me a picture of himself at 35. This guy was unbelievably good looking.
So what do you see, like when you, as a cosmetic dentist, when you're looking at this guy's, what do you see?
I see potential. I want to take this guy and essentially make him more youthful. Give him back what he lost.
Okay.
He lost his youth by grinding his teeth, and we are going to give him back his youth and give him back that beautiful smile that he desires.
So what did you do?
Boy, I mean, we gave this guy, we gave him back his youth. I mean, we did a full mouth reconstruction. We gave him veneers, crowns, implants, but we were able to we were able to lengthen his teeth, widen his smile, fill in those dark holes, and give him back his John Travolta, his youthful look.
Let's take a look.
Oh, absolutely. Does this man look younger? Look at the before and after. He looks
a little younger.
He looks younger. He looks thinner. He looks happier. He is smiling. He's conveying energy. He's got John Travolta back. When I met this man, he came in and he essentially said, look, I have a bucket list. One of them is a beautiful smile. I got my Ferrari. Look outside the window. You can see it. I want a beautiful smile. I want John Travolta back. He went to 5 other dentists. We did this test drive or this reveal. He loved it. His wife loved it, but his wife forced him to go to 5 other dentists to get second opinions.
Okay.
He circled back after visiting every single dentist and he said, look, I love you, Dr. T. He did. And I knew it. I knew he loved me.
Like you just had a good connection.
Yeah, we had a good connection. So I knew, I was in the running. But he said one thing, and he was concerned. He said, everyone says you cannot do this. So I said,
can't do what?
Can't do the smile design without Invisalign braces, a year of braces, or removing teeth. And I said to him, Anthony, we used smile design. We already did the analysis. I did my due diligence. I proved it. I showed you in your mouth. What will it take to prove that I can do this case? And I said, wait a minute. You know what? If I can take your cast on your model with the crooked teeth and in 30 seconds show you that I can straighten them without removing anything, will you believe me?
Okay.
So I grabbed my high speed. I prepped the teeth, perfect alignment. He reached out, shook my hand, and he said, kid, you got the job. And from there, I was able to transform him. He's become one of my good friends.
Good.
And great story.
Now, smile design, you call it smile design.
Yeah.
Like take me through that process, a short version of that process.
Yeah, so smile design is the blueprint that we as cosmetic dentists use to create beautiful, natural smiles. So one of the greatest compliments that you can get from a prospective patient is that everybody loves my new smile and they want to know what I did. So that is, no one should know that you had a transformation. So, smile design is the blueprint, and what makes each smile unique is we use your own facial analytics to create that smile. Every smile should look unique and not off the shelf. So we use your facial analytics to create your smile, and it is a blueprint unique to you.
Now you say that women have different veneers than a man. Like the shape. Like,
sure.
What do you mean by that?
So women have different shape and sizes than men. Women have, essentially could have curved, they're more curvy on the incisal edges, and you can feminize somebody or you can masculinize somebody by creating straight edges. So essentially, we look at your face, we create that incisal edge by looking at your pupils. We create that midline that is specific to, the midline of your philtrum, your glabella. We use these landmarks to create something that is unique to you and fits your face. Here's a guy who came to see us. He didn't know, what he liked. He just liked to smile. He didn't know how to smile. So essentially, he came to me and said, Doc, is this the worst smile you've ever seen?
They'll say that?
They will say that. A lot of these people have, they've lost their confidence in their ability to smile. He said to me, Doc, I just want to smile again. What is that you can do? And I said, I looked at him and I immediately knew, I was able to visualize the final product, and I knew I could help him. And I said, you know what we're going to do? We're going to give you a beautiful smile. We're going to make your gums healthy. We're going to fix your broken teeth. We're going to give you some veneers, some crowns, some implants, and we'll give you that ability to smile again. After, this is what he looks like after we were done.
Wow, looks good.
So this is what we were able to provide for this man. And as you see, he is smiling, but he hasn't let loose yet. So he is.
What do you mean let loose?
You know what? After he's still guarded in his smile. He hasn't smiled in 20 years.
So he's not like smiling big.
He's not smiling big. That's a forced smile. He's learning how to smile. But 10, 20 more compliments, and he'll be letting them loose. In fact, anecdotally, when he's coming in now, he's smiling. He's wearing beautiful shirts. He's scented. He's a new man. Put these side by side, what do you see? Do you see somebody who appears more happy? Does he appear more confident? Does he appear more educated? The fact is, this applies to everyone. Of course, that's what a smile can do for you.
He's definitely more handsome in the after.
Absolutely. He's a more confident, more handsome individual.
When they look in the mirror for that first time, are they kind of blown away? Like, what do they say?
Absolutely. I mean, they're blown away. This is why they came here. They came here to, have the ability to smile again. So here's another patient. This is Ava. She came to me on her birthday. She came to us on her birthday